Education in the time of COVID is the subject of this week's In-Depth segment. Susan Caddo visits with the heads of our three branches of education: Common Ed, Higher Ed, and Career Tech, to find out how they are coping with the ever-changing challenges of the pandemic.
Well, thank you, Rich. We're here with some folks who have taken some time out of their busy schedules to talk with us about the state of education in Oklahoma right now during these trying times. And I'd like to introduce our panel of guests to you. First, we have Dr. Marcy Mack, who is the director of Oklahoma's Department of Career Tech Education, Superintendent Joy Hoffmeister, who is the state superintendent of schools for Oklahoma, and Dr. Glenn Johnson, who is the chancellor of the Oklahoma State Regents for Higher Education. Thank all of you for being with us today.
Good to be here.
Thank you.
Thank you.
Chancellor, let's start with you. Can you give us a status update of where things stand now with Oklahoma colleges and universities?
I think it's important to say, Susan, that since we started in March, every decision, every discussion that we've had is centered around making sure that we're doing everything that we can to make our campuses safe and secure for certainly students, faculty, staff, and visitors on our campuses. If you think about it, in early March of this year, we were in face-to-face instruction on all of our 25 campuses. Literally on a dime during spring break, we successfully transitioned from face-to-face instruction to online instruction, and I did that with over 173,000 students. Important because it gave those students the opportunity to continue their college education. Summer for higher education was also strictly an online endeavor on our campuses, but during that time, Susan, we also worked to look at ways to successfully and safely reopen for the fall. All of our campuses open for the fall. OCCC, Oklahoma City Community College in Oklahoma City, has gone to a complete online format, but their campuses are still open for all the services. Certainly in doing that, there are some protocols that we looked at as we reopened: testing before students came to campus, testing opportunities when they were on campus, mandatory mask mandates on all of our campuses, quarantining on campus when students did test positive for COVID-19, and then looking at protocols where if certain classes were over 45 or 50, to transition those into online courses, all in an effort to keep our students and faculty and staff safe during this process.
Dr. Mack, how about the career tech arena? How are things going right now at this point in time when dealing with COVID and educating your students?
Well, the technology centers, with the opportunity to serve both secondary and post-secondary students, making sure that we're providing that environment for our students as we work with our Common Ed partners and as we work with our Higher Ed partners. Our technology centers worked diligently in March to be able to provide distance education for students so they could finish out the year through May the 15th. During that process, a lot of our core of what we do in career and technology education is hands-on. It's vital that students have that experience and be able to simulate the workplace environment. So many of our instructors and administrators stepped up and provided various simulations. They worked with business and industry to be able to capture video, connect them with industry leaders, to be able to offer a classroom environment that provides them with a work environment that they would be transitioning into. After May 15th and moving forward, because one of the components for our technology centers is to make sure they're meeting the needs of business and industry with customized training. So starting in latter part of May, 1st of June, some of that customized training for our business and industry that we get to provide across the state. They provided small classrooms, no larger than 10, dividing those out, make sure social distance, masks were required in those environments. They may deliver them at the work site or do a combination where part of the curriculum is delivered distance, and then the other part they could do the hands-on in limited groups. And so the technology centers worked through that through the summer months, and then all of the technology centers open in August at various times during August with in-person. We're making sure, because we do get to offer as well from our state agency assessment for industry credentials and certifications, our testing sites that are open, we are providing various accommodations so that students can still be able to obtain that industry credential and enter into the workforce through various modes, so that they could do that virtually if they need to be, in smaller groups. In our testing sites, top of mind is making sure that our staff is safe and that our students are safe. And I can't say enough at the work that administrators and educators have done across the state of Oklahoma to be flexible and adaptable, making sure that they're still providing high quality educational experiences for our students and our future workforce.
All right, thank you, Dr. Mack. Superintendent Hoffmeister, I saved you for last. You are really under a magnifying glass when it comes to COVID and education in the state of Oklahoma. Not that others aren't, but when you're dealing with the younger children in schools across the state, I think there's really an air of wanting to protect. So where are you at? I know you've been so busy. Where do things stand with elementary, middle schools, and high schools across the state of Oklahoma?
Well, we have 700,000 students pre-K through 12th grade. Some of our students are attending career tech centers in high school, as well as our universities and colleges that are providing concurrent enrollment. So we work with our partners at career tech and at the university levels as well. But what we are also grappling with is different modality. Some of our students are receiving education in the home through distance learning. Some families do not choose to send their children back into an in-person setting, and that opportunity is there. But we do have a large number of students, most Oklahoma students, are in a classroom setting, and they are working with teachers who are trying to meet the different needs of the students in their classroom. Some may be through distance learning, others they're in the classroom, and all of it happening all at once, which creates quite a challenge, as you can imagine. And if you have any friends or family who are educators, you realize this is a time where they are working their hearts out, stretched very, very thin, yet everyone is doing their utmost to keep safety top of mind and also close any learning gaps that presented last spring with the closure of school buildings, and then could have persisted over the summer months and into fall.
So Superintendent, I'm going to start off this next question with you. I want everyone to answer, but I'm going to start with you. When you were making the decisions whether or not to let students come into a physical building or have at-home learning, whether it's statewide or school districts are coming and talking to the state, how hard is that decision to make? Because we've heard so much about parents who they have to work to pay the bills, but if their kids have to stay home, they can't go to work to pay the bills, and it's a serious catch-22 for many Oklahomans. So how much does that weigh on you as the superintendent of Oklahoma, and what goes into your decision-making process?
It is a great weight that we saw really unfolding last March, when the novel virus is truly a virus that no one had data or much information to make decisions upon. We know so much more now, so that is a great help. The decision to take over the operations of all schools in the state happened last March and had never happened up to that point in our state's history. That expired at the end of the school year. The State Board of Education, which is a separate board from myself, I am chairman of that board, but one vote, yet I did lead that effort to close schools at that time for the safety and well-being of everyone in those buildings. However, that expired, and the return of our normal governance structure, where local school boards make decisions for their own communities, recognizing that the virus looked different in different locations in Oklahoma, is something that began last summer and continued into the new school year. So that said, I think it's very important that we all recognize that whether a school started out in person, there is still an issue with students who become positive or exposed, or staff who are exposed and then are all in quarantine. Then that presents some disruption, and disruption that was unexpected by hundreds of families that had children exposed in a variety of settings, whether that was after school or they learned of exposures within their own peers in classroom settings. But this is the challenge of how can we keep learning going with disruptions that the path of the virus present, and also allow for some differentiation in what decision-making occurs at local school district levels, but it all has to be in compliance with and aligned with the CDC and our Oklahoma State Department of Health. So that's the challenge.
I'm sure it's a challenge for all of you in that no matter what you do, you're going to take criticism. And we were talking earlier, Chancellor, I want to go to you next. We were talking about the powers of prognostication that you must possess when you're looking down the barrel of a semester and trying to guess what's going to happen. The numbers in November for the state of Oklahoma have skyrocketed with positive cases. That's towards the end of a semester, where it wasn't the case in August when people were making decisions about this. I looked it up. According to its website this week, OSU saw a 10.44% positivity rate in testing just this week alone. Nearly 1,100 tests were performed, and so that's 113 positive cases. What can you do at this point when you get into the middle of semester and you see a spike like this? How much does that weigh on you, much like the superintendent talked about with the kids? You know, you don't have to worry about parents, but you do have young people to worry about their safety.
Susan, I think it weighs on all of us, and the best thing to do, and what we've always tried to do, and I know our campuses do this, is to keep the safety and health of everyone on campus as the top priority, as the primary concern, and really to look at that in terms of what's the best decision in the interest of our students and our campuses. We acknowledge that no decision is going to have 100% support. So I think you look at it, you look at the objective data, and then you make the most informed decision you can make. With regard to OSU, I might say specifically, they have made the decision with respect to your question about the spike in COVID cases, that they will, after the Thanksgiving break, which of course will start early next week, their students will be online for the balance of the semester. And many other campuses are doing this as well, Susan. And then so you'll have a break from essentially November 23rd or so all the way to that third week in January, starting later in the spring, not having spring break, which of course could be a super COVID spreader, and then trying to get through the spring semester. Also, when students do test positive, there are provisions on our campuses where they can quarantine in other parts of the campuses that are remote and go through those protocols, whatever those may be, where they're separated from the general population. So I would just say, looking at all these, we look at safety, we look at making the best decision based on the data. And frankly, I think our campuses and the higher ed system have really done a phenomenal job in an attempt to mitigate the spread of COVID-19 since March.
According to the AARP, 36 states, their latest numbers I think came in yesterday, 36 states have statewide mask mandates. When we look at students in school, did they get COVID from a classmate? Did they get it outside of school and bring it in? Efforts to contact trace. Would a statewide mask mandate mitigate that concern of students bringing something into the classroom if they do if the individual school districts do decide to keep their schools open?
We know masks work, and our universities and college campuses have done, I think, a very good job of reinforcing that message. We need to see mask wearing uniformly across the state. It will help suppress the virus, and that is based on evidence. We can see that the information from the State Department of Health tells us that those municipalities and communities with a mask mandate in place are seeing a lower spread of the virus. And so keeping schools open and the opportunity for kids to learn is dependent upon the behaviors of communities. And when we think about mask wearing, it is one of the simplest, most effective ways to reduce transmission. But I also think we have to keep our eyes on the pediatric rise in cases. There were some who didn't think kids would get COVID at the same rate, and certainly it's not the same rate. But we've seen a change in the numbers in November from previous months having maybe 30 to 50 pediatric cases a day. We saw that spike at this month in a single day, 608 children ages 5 through 17 years old in that cohort, and then hundreds each day afterwards. So we can and we must contain the virus. It's a global pandemic. A patchwork effect only allows room for increased spread, and it can be slowed with a more collective effort. And we ask Oklahomans to do that as those who are trying to help with educating our kids.
All right, Dr. Mack, final words from you.
Appreciate the opportunity to have conversation and talk about the work that educators are doing across the state on all of our agencies. When we look at Common Education, Regents for Higher Education, and Career Tech, one of the things, and each of us have stated that, is the partnership and the support that we provide each other as we're working through this. Because when we're talking about students, we share students across all of the spectrum, and making sure that their safety is a top priority, making sure that we are providing the best support we can to our school districts, administrators and teachers, and helping to work through making sure that our students are getting a quality education in a variety of ways, and making sure that we're filling those gaps so that we do not lose that time period, and that we can help to move forward, and utilizing all things that we can to help mitigate spread, mitigate risk, and continuing to learn as we learn more about information, whether it be the Department of Health or CDC, making sure that we're implementing those across the board and providing that support at the local level.
And Chancellor Johnson, you get the final word. You and I have talked about prognosticating, and sometimes you just don't see what's coming down the pike. Any final words for Oklahomans, words of advice or information you'd like them to know?
Couple of quick thoughts, Susan. I think I want to stress also what I consider to be a unique and a great partnership with higher education's partners, with Superintendent Hoffmeister and K through 12, certainly with Dr. Mack and Career Tech. We are focused. We meet frequently, and our focus is always on how we can strengthen the education pipeline, how we can enhance the educational opportunities for our students, whether they're in Career Tech, K through 12, or higher education. I just want to say it's a pleasure to work with both of them. I think they're great partners.
I'd like to thank all three of you for taking time out of your very busy schedules to share with Oklahomans what's going on with your various institutions. I would like to let everyone know that Superintendent Hoffmeister chairs the OETA board, and Chancellor Johnson is a board member for OETA as well. Again, thank all of you, and take care.